Hello, everyone, and welcome to today's Journal Club hosted by the International Society for the Prevention of Child Abuse and Neglect. We thank you for joining us today and appreciate all you're doing during this challenging time to help children. Today, Dr. Jane Solowski will share with you the collection of articles in the special issue of Child Abuse and Neglect addressing interpersonal problematic sexual behavior of children. The research in this issue was conducted in Australia, Ghana, Israel, and the US, further demonstrating the growing global recognition of the need to prevent and address child problematic sexual behavior. Key themes in the articles include the need for alternatives to legal procedures and for a clear and coordinated path to report and effectively respond to child problematic sexual behavior. Articles also present on the clinical and cost effectiveness of evidence-based treatment, the need for effective and accessible prevention interventions, and the critical role of parents. Please note that the introduction to the special issue is available to you now in the handout section of this webinar. Also, many of the articles from the issue are available open access on the Elsevier website. I will share that link in the chat box throughout in the presentation. Right now, I have everyone on mute to avoid background noise. We welcome you to please enter any questions or comments you have in the questions box throughout the presentation. Dr. Solowski will respond to questions and comments at the end as time permits. The recording of the webinar and the slides will also be posted on the ISPCAN website afterward for a limited time. Then they will be archived and available for members only. Dr. Jane Solowski is a clinical child psychologist and the director of the Center on Child Abuse and Neglect at the University of Oklahoma Health Sciences Center. She is currently a professor in the Department of Pediatrics. Since 1997, she has been the director of the Children with Problematic Sexual Behavior Program, which is an assessment, treatment, and research program for preschool and school-aged children. And she is also the director of the National Center on the Sexual Behavior of Youth, which provides training and technical assistance to communities addressing this issue. We thank you so much, Jane, for being with us today. Before she begins her presentation, we'd like to ask the audience a few poll questions. If you can just hold one moment, please. Okay, we're going to start with a question about what region of the world you are from. Hopefully you can see it now. Jane, is that visible? There we go.
Yes.
Okay, I'll give you a few seconds to answer. We only had space for 5 answers, so apologies if your country or region doesn't seem represented. Okay. I'll share those results. So it looks like most of you are from the Americas, followed by Europe, and representation from Africa, Asia, and Oceania. Great, thank you. Okay. So let's do a second one. This one is asking about your discipline. If you could please share with us if you are in medicine, social work, psychology, research and academia, or other. Again, apologies that we don't have space to list all of them. Okay. And it looks like most of you are in social work, followed by psychology and other, and a few in medicine and research. Thank you so much. Okay, and the last question is about your familiarity with this topic of children with problematic sexual behavior. If you could please let us know if you're very familiar with it, somewhat familiar, or not familiar. Okay, so it looks like most of you would say you're somewhat familiar with the topic. Okay, thank you so much for participating in those questions. Now I'm going to turn it over to our speaker. Just one moment. Oops, sorry, let me hide that poll question. Okay.
Okay, let's see if this works.
Okay, that looks great.
You're able to see my screen now?
Yes.
Thank you very much for that lovely introduction. And thank you all for participating in the poll so I can feel like I know you even better. I'm thrilled to have so many people interested in this special issue. The topic of children with problematic sexual behavior is near and dear to my heart. I've been doing this work since the 90s and excited to share this latest special issue on the topic and really how the area has evolved. I was honored to co-edit the special issue with Dr. Elizabeth Letourneau and Dr. Barbara Bonner. Dr. Bonner is a mentor of mine throughout my career, so to be able to do this was a phenomenal experience. I'm going to start with a few background definitional issues and then go through the 10 articles that are this special issue and provide information about each of those studies and those outcomes. We are talking about children, and we're using the term children throughout the age up to 18. It aligns with the UN Convention of the Rights of Children. And using the term problematic sexual behavior to mean that sexual behavior of children that's developmentally inappropriate and potentially harmful. It's different than typical sexual behavior or normative sexual behavior, understanding that there is sexual behavior throughout childhood that is normative. And as a mom of 2 teenage girls, sometimes I wish it didn't start till the 20s, but it does, even early age. But what we'll be talking about throughout these papers is around problematic sexual behavior, and specifically interpersonal, that sexual behavior acted out toward another person and typically another child. You'll notice that we're very specific in terms of the language that we use, using child first language to reduce assumptions, stigma, and biases that can be associated with labels that can be placed on people. And by using child first language, it emphasizes understanding the child as a whole and not just focusing on a single aspect of them. The topic of problematic sexual behavior in terms of research really began being looked at in the 80s with pioneers, doctors Bill Friedrich and Tony Kavanaugh Johnson, who conducted the seminal work in this area. Then in the mid-90s to late 90s, 2 randomized clinical trials occurred with Dr. Bonner and colleagues and Pithers and Gray being awarded separate randomized clinical trial funding. And then an accumulation of the research up to the 2000s was published in the United States Association of Treatment of Sexual Abusers Task Force report, which incidentally is being revised currently because of all the research that has been done since that time. There's a greater understanding of problematic sexual behavior of children growing really across the globe. It's difficult to know how many youth there are, in part because there's not a single entity that tracks and measures this. And it's a topic that you can imagine is a little difficult to research because you're asking parents to allow your children to talk to researchers about sexual behaviors. Of the research that has been done in looking at Child Protective Service records, law enforcement records, juvenile justice records, it looks like about 1/3 of child sexual abuse, it's another youth who've acted out upon the child. If you look at child reports or research in which are surveying and interviewing children, it appears to be an even greater percentage, maybe even up to 75%. There's concerted efforts to now begin to look at child sexual abuse more as a preventable public health issue, and you'll see a couple articles addressing that. And there's been a great deal of work looking at treatment, engaging families, cost, and related areas. And so as was shared, this is a global special issue, which is exciting to all of us. So we have contributions from Australia, Ghana, Israel, and the United States. And rather than going through the key themes, because that was shared, I'll go ahead and dive into each issue, each of the articles, and summarize at the very end. So Schaller and colleagues published a paper on early identification of youth with problematic sexual behavior, and this was a qualitative study trying to understand how do we know problematic sexual behavior has occurred. So looking at what's the process of disclosure and identifying, and how does that information reach professionals. And the study was done with the belief that we really need to know that information to know how to access and have them involved in early intervention and not have children fall through the cracks. So this study examined a variety of pathways in which someone knows a child has had a problematic sexual behavior, and it was done through qualitative interviews with 8 sites across the United States. And the interviews were done with mental health providers, agency directors, and what we call stakeholders like law enforcement, child welfare, judges, schools, etc. So in terms of how problematic sexual behavior was discovered, a primary area was a victim, child victim disclosed to someone. Oftentimes schools was the #1 area. It may have been a child sexual abuse prevention class that then they disclosed, or they told teachers or counselors. They may tell family members, may tell another child who then tells one of these adults. And sometimes the children are in therapy for other reasons and then disclose this. The second major way that problematic sexual behavior was discovered was through someone walking in, seeing it, or another specific theme around that was through technology. So finding evidence of this on cell phones, iPads, and other devices. After that was known, then what happened? And there were 3 main notification pathways. One was the established child welfare or child abuse hotlines for reporting. Second was local law enforcement. And then the third, less frequent, but one of the other main pathways was a specialized treatment in the area. There were a number of barriers that were noted in terms of the process of identifying and then responding. In particular, that the system was fragmented. It was not clear who to tell and what they would do with that information. There were themes around of a lack of a clear practice guidelines, policies, or strategies in terms of how to tell, who to tell, and what to do with that information. There were specific barriers to the parents and fears the parents had in terms of what would be done with this information, what would that mean to their child, how would they be labeled, treated, would they be registered as sexual offenders, and similar types of fears. So the recommendations were to improve public awareness, develop and disseminate clear identification and response protocols, and educate those frontline workers on the topic and how to respond. Tenner and colleagues then had the second paper, the Child Advocacy Center's interventions with sibling sexual abuse cases. This was a cross-cultural comparison of professionals' perspectives and experiences. A little bit of what children's advocacy centers are is that these were developed, actually started in Huntsville, Alabama, with the goal to improve how child sexual abuse cases were responded to reduce the fragmented response and enhance the child well-being, so that the interviews, investigation, and response was done in a more coordinated, collaborative fashion with the multidisciplinary teams. Those CACs have flourished and have gone international. And so this compared a CAC in Israel to a CAC in the United States, getting the staff perceptions on this process through focus groups with both of the CAC's personnel. The major theme that came out was a perception that this is a family crisis and the parents are in an enormous dilemma. They focused on the parents' negative emotional responses and the impossible nature of that predicament. And I added some quotes from that paper that I think gives you the sense of that urgency and crisis. The biggest issue we run into is the parents. They struggle with how to protect the victim and the offender. Then that prevents reporting and cooperation because they're trying to figure out how to help one without harming the other. Other quotes were related to how emotionally complex this is, not only to the parents and kids, but also to the team, and that they see this really weighing heavy on the parents, saying that when they enter the room, there's such heaviness, they look totally different from parents whose child was abused by someone else. There were some differences across the two child advocacy centers, with the U.S. having separate focuses. That the child victim, the focus was on a therapeutic response, and on the child who acted out, who had problematic sexual behavior, it was more of a legal response. The Israel CAC had a family-focused response, with the decision-making integrating what would be best for the family, including the child who was victimized, the child with problematic sexual behavior, the parents, and siblings. And the differences appear to be related to the different legal and cultural context in terms of how to respond to sibling sexual abuse, which is actually emphasized in the next paper, the Exception Committee as an alternative to legal procedures in cases of sibling sexual abuse, an approach of an Israeli CAC professionals. You may never have heard of an Exception Committee. It appears to be unique to Israel. It's an amendment to their mandated reporting law that extends the duty of reporting cases when there's a suspected that a minor was sexually abused by a member of their family who was also a minor. And this amendment is allowed to then have a integrated family therapeutic response and promote disclosure and prevention of sexual abuse between the minors and ensure proper care. For this study, it's a qualitative study examining the charts of 40 cases of sibling sexual abuse to identify characteristics of the cases that were referred to the Exception Committee or referred to a legal procedure for the response to this. And what they were doing is examining what are the characteristics of everything involved that seem to lead toward the Exception Committee pathway or the legal procedures. So in terms of characteristic of the person who sexually offended, a legal response rather than an Exception Committee response was more likely if they had viewed that youth who offended as more pathological, failing to take responsibility, and if there were offenses toward others outside of the family in addition to the sibling. Characteristics of the child victim that affected the pathway was that an Exception Committee response was more likely when the child victim appeared to feel protected, believed, and did not desire a legal response. When sexual acts were more severe, they led to a more legal response, and families that appeared more chaotic or dismissive were also more likely to have a legal response. There were case differences, but there's no specific written guidelines or policies for the Exception Committee. And so that was a recommendation to help facilitate that process, and that research be conducted in examining the usefulness of the Exception Committee in other areas, as well as research beyond the chart review, such as interviewing the decision makers. In the fourth paper, Whamzer, Nanny, and Campbell examined post-traumatic stress symptoms and how that linked to problematic sexual behavior. And this research stems from a long historical perception that problematic sexual behavior is associated with sexual abuse. And indeed, there is a link of sexual abuse and problematic sexual behavior, that it's a risk factor. However, there's also evidence that most children who've been sexually abused don't have problematic sexual behavior, and not all children with problematic sexual behavior have been sexually abused. So it's important to look specifically at those kids who've been sexually abused. What are the characteristics by caregiver and child report of the abuse, the stresses around the abuse, and post-traumatic stress disorder, and how that was associated to problematic sexual behavior, and particularly interpersonal. So that they looked at data of 254 children and examined the child and caregiver reports. And what they found was that when looking broadly at predictors of problematic sexual behavior, both child and caregiver reports of levels of post-traumatic stress symptoms were related to the global problematic sexual behavior. However, when looking more specifically at interpersonal problematic sexual behavior, they found that boys, younger children, greater severity of the child sexual abuse, in addition to the post-traumatic stress symptoms, were associated with interpersonal problematic sexual behavior. And all of these areas are then important to look at in terms of efforts for early intervention to allow for prevention of problematic sexual behavior. We move into a couple studies looking at treatment. Jenkins et al. Presented preliminary findings of problematic sexual behavior cognitive behavior therapy for adolescents in a community outpatient-based treatment setting. So they looked at this lower intensity, because it's in the community, once a week group program for the youth with problematic sexual behavior. Again, these are adolescents and their caregivers. 49 youth met the inclusion criteria and initiated the services, with 31 of them completing. And they found that legal involvement was related to a more likelihood of completion of treatment. Further, they found significant reductions in caregiver-reported youth internalizing and externalizing problems. There were 6 caregivers who completed a measure of problematic sexual behavior, which reduced from a 5.3 to a 0.17, but it was not quite significant. It was a trend toward that. And they concluded it was a promising approach in looking at adolescents with illegal or problematic sexual behavior and the importance of involving caregivers. Dopp and colleagues then looked at an economic value of community-based services for youth with problematic sexual behaviors, and using a mixed method, both quantitative and qualitative approach, they investigated the economics related to implementing this problematic sexual behavior CBT program. The costs were examined from 6 sites across the United States who provided PSB CBT for youth ages 10 to 14 years. There were 413 of these youth. And they looked at the cost effectiveness ratio to compare the direct and indirect costs of problematic sexual behavior to self and caregiver reported outcomes, looking at both reductions of problematic sexual behavior as well as externalizing and internalizing symptoms and trauma symptoms. The cost effectiveness ratio is the amount of dollars per reduction in a full standard deviation in symptoms, and found that the reductions in problematic sexual behavior cost was $1,772 US and ranged from a little less than 3,000 to a little less than 5,000 per youth, depending on those secondary outcomes of externalizing, internalizing, and trauma symptoms. One of the sites, one of those 6 sites, in addition to the group program, supplemented the program considerably with an average of 30 individual sessions and significant case management. That increased the cost significantly without having added benefits. So comprehensive community-based treatment hold considerable promise for reducing social well-being and financial consequences of problematic sexual behavior of youth. Then Boykai of Ghana looked at juvenile sexual offenses and looked at prevalence, risk, and correlates. And this is done with very limited previous research done in Ghana. So very important to be able to look at this in the community. They were able to collect data from 264 males, ages 12 to 18. And some of the youth were in schools where others were in correctional facilities. Now, for those in the correctional facilities, a few of them were there due to sexual offenses, but a larger proportion of them were there due to theft. And they interviewed the children on individual and family factors that included looking at sexual offending behaviors and then the predictors for that. They found that almost 17% of the youth reported to commit a sexual offense. It's important to note how they measured it, and these were behaviors that involved force and coercion. So if you had a broader definition of sexual abuse or harmful sexual behavior, the rates would be even higher. But 17% had reported force or coercive sexual behaviors. Of those who committed those sexual offenses, they were more likely to have other delinquent behaviors reported. Further, individual factors of smoking tobacco or cannabis and paying for sexual behavior significantly increased the risk of reporting sexually offending behaviors. A number of family risk factors were quite strong in predicting sexual offending behaviors: parental neglect and abuse, parental conflict, parents who abused alcohol, and deprived family economic conditions emerged as statistically significant factors. Then they looked at the factors individually and combined to look at what was really the strongest factors and found that parental neglect was more than 6 times likely to engage to sexual violence compared to those that did not have parental neglect. And so it's a really important study to look at areas of protection and prevention, as well as targeted areas for able to then build on and develop strengths in parenting. Delango and colleagues conducted a really innovative study to look at children who engaged in interpersonal problematic sexual behavior by looking at medical records. And this was really intriguing. So in their medical center, they were likely to serve not only the child victim, but also the youth who acted out upon that child. So they looked at medical records across an 11-year period and found the cases when there was a youth who acted out on a youth, and looked specifically at those 218 records of the children who had a child victim. Then they went through those charts and coded lots of details: the sociodemographic factors, experiences such as abuse and trauma, school factors, diagnoses such as ADHD, and exposure to sexually explicit media. The factors that were related to the children having interpersonal problematic sexual behavior where they were much more likely to be boys, with 83%, with a mean age of 10, but range from 4 to 17. That's a very large range. They were, excuse me, very likely to be related to the child who is engaged, with 75% of them being related, and 58 had been reported to have viewed sexually explicit media. 47 had experienced sexual abuse. Further, those youth who acted out with interpersonal problematic sexual behavior were like to engage in multiple types of interpersonal problematic sexual behavior. Older children were more likely than younger to specifically view sexually explicit media, and those youth were more likely to have more invasive acts in their interpersonal problematic sexual behavior. Again, important themes to consider when we get to prevention near the end of today's talk. So prevention efforts will be important to start young, prevent adverse experiences, address those trauma experiences early and therapeutically, and address exposure to sexually explicit experiences. Shields and colleagues then looked specifically at prevention in their Help Wanted, Lessons on Prevention from Young Adults with Sexual Interest in Prepubescent Children. The goal of the study was to advance knowledge about adolescents and young adults who have the rare but concerning sexual interest in children, so that they can better inform the development of prevention and mental health efforts. While sexual interest of youth in younger children is quite rare, it's an important area of study in order to be able to address and support and find ways to have effective prevention. To do this work, they interviewed 30 young adults between 18 and 30 from North America, South America, Europe, and Australia. Participants reported that their sexual interest in younger children emerged during adolescence. And as part of this process, they reported a variety of emotions: fear, shame, isolation. I added one of the quotes of one of the participants. It's really terrible. It's something I never would have ever wished for. All you see in public, media, everywhere is just that what a monster these people are. Growing up, that's what I associated that feeling with. It's awful. It's never something I would ever want to have, and I wish it would go away many, many, many times. Part of the surveys, the interviews with them, were also to try to ask and determine, are there strategies, are there things that would have made a difference or does make a difference to navigate life, to be able to make good decisions despite the sexual interest. And what they shared was that what was very important is to have positive messaging and to have support from families and the community. The biggest thing that could have helped me, honestly, would have been role models. If there were people in the media who were open and made it clear that just because you have those attractions does not mean that you're going to become a monster. It's really no different than somebody has an attraction to an adult woman. They don't go out raping, they treat them with respect. There's nothing different in terms of being attracted to children. McKibben and Humphreys then looked broadly at child sexual abuse prevention and future directions in Australia. They begin their paper by talking about that a public health approach to child sexual abuse prevention is very critical, and they're looking at it from an Australian perspective. They noted that it's complex to be able to look at child sexual abuse prevention. There's not an easy single way. There are many factors that are involved in the development and trajectory, and that the targets would be different, whether you're looking at children, adolescents, or adults. Further, what makes it difficult is the emotionality related to it. Child sexual abuse is a horrendous public health issue, and there's a lot of emotions associated with needing to prevent the behaviors. And some of those emotions lead to binary perceptions that end up inaccurate. So beliefs that people are in one category or another, which takes away the complexity that we know that underlines understanding the behaviors. So they believe that now in Australia, there's a good practice in delivering and evaluating interventions for young people with harmful sexual behaviors and being able to apply that to child sexual abuse prevention. They begin with talking about primary prevention and describe initiatives across the continent in terms of delivering primary prevention messages around sexuality education, sex education, respectful relationships, etc. They note that what's missing is targeted messages around preventing harmful sexual behavior of children. They recommend greater programming addressing boys because indeed adolescents with illegal and harmful sexual behavior are primarily boys. In some other research that they've conducted where they interviewed youth with problematic sexual behavior to look at things that would have prevented them from demonstrating the behavior in the first place, a big theme of that was around sexually explicit media. And so broadly, what the authors said within primary prevention, needing greater work to address exposure to and use of sexually explicit media, including pornography. There's great school approaches utilized, and they recommended examining those school approaches to see if it changes behavior and not just exclusively changing knowledge around child sexual abuse, and then specifically changing behavior around exhibiting harmful sexual behavior themselves as kids. Further, lots of research indicate caregivers, parents are critical for the well-being of children and making a difference for them to be on a positive pathway in healthy relationships and not having problematic sexual behavior. So marketing campaigns for parents and caregivers to then be able to have the self-efficacy and confidence and knowledge to directly talk to their own children and address child sexual abuse prevention. It's a difficult topic for parents. They feel it's taboo, and so being able to empower them with the information necessary would have a big difference in that primary prevention. Then the article went to tertiary prevention, and so addressing individuals who've been harmed by sexual abuse, as well as services for those who have harmed others sexually. Describing crisis hotlines available, having immediate trauma-focused care available, as well as having well-established services for the youth who've harmed others sexually. Recommending in those services integrating, addressing sexually explicit imaging and media, including pornography, and also recommended addressing the social constructs of gender and sexual identity more embedded throughout those tertiary prevention services. And so they report a case for secondary prevention and targeting risk and protective factors being important, that there would need to be different programs for youth that have different risk, needs, and protective factors. To establish this, there's a need for longitudinal research to better understand those trajectories. So not all young children develop into adolescents with harmful sexual behavior. Not all adolescents develop into adults with harmful or illegal sexual behaviors. Some do, some go down different pathways. We need longitudinal research, which recommended to better understand these trajectories and consider focused prevention efforts to then target them, and specifically messages around young persons with atypical sexual interests. So taking back again from the earlier paper, that Shields et al. Did, where they interviewed those adults and young adults in terms of their atypical sexual interests. What can those messages be done to develop the Health Wanted program or other programs to help those children be able to have a more positive pathway in their life and keep the community and themselves and others safe? So they report that researchers must maintain a balance between not catastrophizing every incidence of harmful sexual behavior for children and young people, but continuing to explore the progression of behavior through childhood, adolescence, and possibly into adulthood, so that early interventions can be developed and tested through trials. So the Australian Child Sexual Abuse Prevention Agenda, they reported, would benefit from adopting a measured public health approach involving the design, implementation, and evaluation of primary, secondary, and tertiary interventions. So across these 10 papers, a number of conclusions can be drawn. One piece throughout is to really think about and utilize a developmentally appropriate response and informed policies. So having clear policies on how do we identify so that kids don't fall through the cracks, and that we respond in a way that leads to safety and therapeutic responses so that all can heal, particularly in terms of that sibling sexual abuse cases. So having some innovative approaches like the exception committee being able to be looked at, as well as other possible strategies to have pathways for those professional responses. There are implications to make sure that the professionals and community members are well informed about the population and prevention of child sexual abuse, from the primary, tertiary, whole range of prevention efforts. Further, in terms of prevention efforts, really looking at how we can build resilience in families. And in the Ghana paper, looking at neglect and the complexity that leads to neglect, and how to be able to address that to lead to instead building resilience in the families and having those youth on a more positive path. The importance of addressing trauma early and directly was emphasized, and to directly address the impact of sexually explicit media, and including preventing that exposure in the first place. And then finally, to be able to address messaging for youth at risk, particularly those that have atypical sexual development, to be able to build their support to make good decisions and address feelings of their own loss and isolation. Well, that is my conclusions, and we actually do have about 15 minutes left for some questions.
Great. Thank you so much, Jane, for sharing all of this really important information with us. I'm going to take the screen back. One moment, please. Okay, so let me start with a question from an attendee about whether you know of any research on problematic sexual behavior incidence or prevalence among children on the autism spectrum or other categories of developmental delay or disabilities.
That's a very important question. Thank you for asking that. There is work done primarily with adolescents, and there's actually on the website of the National Center on the Sexual Behavior of Youth, under resources, there's a specific section in the bibliography, as well as in the downloadable section on work on youth with developmental disabilities, as well as youth with autism. Some of the research that has been done is it's important to think about how children are perceiving social accounters. And so one risk factor for children on the autism spectrum is not having a clear understanding of boundaries, consent, and being able to read such things as nonverbals, and so may make decisions on their relations, particularly as they're going through puberty and having normal sensations in terms of wanting relationships, but not having the skills to maneuver the interpersonal interactions. And so some strategies that can facilitate that is using more visual and concrete strategies to teach consent, boundaries, sex education materials, etc. Another area in this particular topic is the lack of accurate information on sexual development and sex education of the youth, in part because the adults around them may not perceive them as sexual beings in the same way as typically developing peers. So a critical part of it is empowering the teachers, the caregivers, and other adults to support their healthy sexual development by directly addressing these topics with them in a developmentally appropriate manner.
Okay, thank you. We've had a few questions that are related to disclosure and the challenges of disclosure. One person is talking specifically about boys who may have been sexually abused themselves and have not disclosed that, but instead are kind of acting out on what they have learned. Can you speak to that?
It's a very important point that indeed it is difficult for children to disclose, and there has been research that demonstrated even more difficult for boys to disclose. And so I think those last papers in terms of prevention are key to being able to help create an environment so that the children feel the trust to be able to disclose in terms of experiences they have, as well as to recognize perhaps in an earlier situation that things are breaking rules, are abusive, and being able to note that those boundary issues or other interactions that are making them feel uncomfortable are ones that they can share with their caregiver or teachers or others, and being able to support them. Some of the work in the child abuse prevention arena is trying to help teach children not only about child sexual abuse prevention that gears the message in terms of adults acting out with them, but also letting them know that other youth may break those rules and how it's important for them as children to all follow the rules, to respect each other and not break what we call sexual behavior or private part rules.
Okay, thank you. We have a couple questions related to exposure to pornography that you referred to. This person is asking how strong the relation is between exposure to pornography and problematic sexual behavior. And along with that, someone else was asking if there are resources that you can recommend specifically for supporting kids around pornography.
It is an area that is a great deal of research is needed. And part of the difficulty is how do we define pornography and sexually explicit media? So pornography, when I was young, was still pictures of naked bodies, where nowadays pornography that children have access to involves violence, themes around families, and are videos as opposed to still pictures. There's research to suggest that a third of internet traffic is pornography, and a large percent of that is this more concerning violent sexual behaviors. The research on children's exposure and the impact of that has fallen behind our kids being exposed to it. Much of the research is more on adolescents and adults as opposed to younger kids. But as things are coming out, there appears to be some relation. The question of how strength of the relation, it's unclear, in part because it depends on what kinds of things they're being exposed to. But again, the paper and looking at the medical histories is seeing that relationship that the kids are reporting exposure, being curious about that, demonstrating the behaviors, and then leading into more problematic sexual behaviors. I would say that it's important for all of these characteristics to not consider single things as the primary cause. So in the 80s, the primary belief that all kids were sexually abused, and that was the sole primary cause of problematic sexual behavior. What we've learned is that it's really a range of risk protective factors that can lead to the development of it. So there are kids who may be exposed to pornography and make a decision not to act out upon it, just as there's kids who've been sexually abused who don't have problematic sexual behavior. So looking at those risk factors of trauma, and not just sexual trauma, but physical abuse, domestic violence, what are the messages they're getting about the world, also their own individual characteristics such as their levels of attention span, hyperactivity, impulsivity, and also again, when we talked about earlier, autism, being able to have an accurate understanding of social cues. A combination of those factors can lead to a greater risk or more protective factors in regards to developing problematic sexual behavior. And also recognizing that in itself is a continuum, that there are concerning, problematic, and then harmful sexual behaviors. There are a number of internet and technology safety resources out there for caregivers, teachers, etc. And rather than provide the list of them, I encourage you to go to ncsby.org or the National Center on the Sexual Behavior of Youth. In the website resources, there's a whole section on internet and technology safety with a number of different websites, resources, and training. A lot of great information's coming out of the UK and Australia, in addition to some of the resources here in the United States.
Okay, great, thank you. We will try to get some of those website addresses in the follow-up email for everyone after the webinar. And then let me ask one about the Ghana paper specifically and the risk factor of neglect. This person is asking, how were parental neglect and deprived economic conditions differentiated given the conflation of physical neglect and poverty?
They interviewed the youth in terms of their perception of their family situation, and they had a separate item around living in poverty that was separate from neglect. And I don't have those specific items memorized to be able to tell specifically how they separated those. I encourage you to download the article to look specifically at that, but it is an important point that poverty and neglect, although are correlated, are separate situations, and it was neglect, not poverty, that was related specifically to the sexual offending behaviors.
Okay, thank you. Let's see, this question is in regard to the cost effectiveness study. She says it's very interesting that the additional personalized interventions did not result in significantly improved outcomes, which would seem to be counterintuitive, and is asking if you have any comments on this. Would this be related to the quality, perhaps, of the personalized interventions?
I'm glad you asked that. It's a great clarification. And the question is, were the added aspects making it more individualized, or was it potentially more than what was needed? And so all the programs provided the community group-based approach for youth with problematic sexual behavior and caregivers. They, on average, provided another 6 or so family sessions and some case management. This one particular site did much more beyond that, with 30 individual, not family sessions, and case management that was in addition to it, which cost a lot more. I think the findings suggest is that for these youth who are able to be served in a community-based approach, the standard approach with a group and a few family sessions was significantly enough to make a big difference, and that perhaps that the monies used to additional individualized services could be reallocated to actually serve more children.
Okay, all right, thank you. Thanks for all your great questions, everybody. I'm just looking to see if we can address one more here. So I think I'll just go with kind of a more general one. I had a couple of questions around your recommendations for raising public awareness of this issue. I don't know if you can speak a bit more to campaigns or methods you would recommend to help those raise awareness in their communities.
It's a really interesting question to toy with. How do you give a message out there that would be received well to the community when you're talking about a kid acting out sexually with another child? Where I've seen it effective is when it humanizes all that's involved, and being able to understand we want to eliminate all child sexual abuse. And that when we look at kids who've acted out, rather than classify kids as bad or good, understand there's a variety of factors that led to that child making that decision. And some of the ways that seem to help more of a universal acceptance is understanding that the media today is exposing kids to sexualized materials that wasn't true decades ago. And that may allow some leveling of the playing field to say, okay, these children may be seeing more and having curiosity triggered in ways that wasn't true previously. And although that's not the single only factor, it's one to consider that we can identify with and be able to then open up to understand the other variety of factors that are addressing it. And so having a message around wanting to keep all kids safe and support them in healthy relationship building and prevention of sexual abuse might help that messaging. But I would love to connect with those who are really good at marketing to be able to really hone in on the message to be effective.
Okay, great. Thank you. We are about out of time, so I would just like to say thank you again to Jane for sharing all of this really important information today. And thank you so much to everyone in the audience and for your great questions. We could not get to everybody's question, but we are going to do our best to connect you with Jane and get those questions answered. So thank you again for that. And let me just conclude with a couple of slides about ISPCAN. One moment, please. Thank you. We encourage all of you to become a member of ISPCAN if you're not already, so that we can continue having webinars like these in the future. Our member benefits include a subscription to our monthly research journal, Child Abuse and Neglect, access to our past webinars and other educational resources, the ISPCAN Child Abuse Screening Tools, or ICAST, and discounts to our congresses, which will resume in 2021. We offer several membership levels, including our new associate membership, which is $35 a year. We also invite you to visit our COVID-19 resources page for a variety of resources for professionals, parents, and children. You'll also find information about our upcoming webinars, including our next one on October 1st on the impact of COVID-19 on children and sport. To learn more about ISPCAN, please visit us at ispcan.org. And a reminder that a recording of this webinar and the slides will be available on our website shortly. And if you have any questions about today's webinar or any of our webinars, please contact us at resources@ispcan.org. Thank you all again for joining us today. Stay safe and healthy and have a great day or night, depending on where you are. Thank you again, Jane.
Thank you.
Okay, bye-bye, everyone.
Bye-bye.